Bulunaka, and welcome back to another episode of our Cancer Awareness Series. I'm your host, Rusila, and joining us today is Ms. Nilashnaram, who is part of our radiology team here at Oceania Hospitals. She will be taking us through the different types of cancer tests that we have, cancer screening tests and diagnostic tests that are available here at the hospital. So you stay tuned as we learn more about these tests, who needs to go for this screening, and taking proactive steps toward your health. During Pinktober, we focused more on breast health. So can you please describe which imaging services that's offered here at Oceania Hospitals, and how does a radiologist help to interpret and use those images for early detection of breast cancer?
So obviously breast health is of great importance, as breast cancer is the second leading cause of death in women. And when we talk about breast imaging, the golden standard for breast cancer screening is mammography. And mainly because mammogram can detect a tumor or a lump before the patient feels it or before there are any symptoms. And we also have ultrasound of the breast. This is usually recommended for the ladies who have not undergone menopause yet. So how there are certain different breast tissue types. So younger ladies tend to have a more dense breast tissue, due to which they can still go for mammogram, but ultrasound would be a better option, since in mammograms the dense breast tissues would appear more like a cloud, and how we see clouds, and if there is a lump present, it would be hidden. So it would not be a more suitable choice for the younger ladies. However, if someone has really strong family history of cancer, and if we see that it's necessary to do a mammogram, considering that the benefits will outweigh the risk, then we do mammogram for younger ladies. But however, ultrasound and mammogram both studies complement each other. So it's better, in most cases, it's better to do both for the ladies for better diagnosis. And if more complex cases, there is also MRI of the breast available in complex cases. Also, when in breast cancer, it's not just the ladies, but we also, there have been some rare cases where we have done mammogram for males, because there are rare cases when males do also have breast cancer.
Thank you. So in the Movember context, what key imaging tests or radiology services are available here at the hospital, and how do, again, radiologists contribute to diagnosis, staging, or follow-up of these cancers?
I previously mentioned that breast cancer is the leading cancer among women. Similarly, prostate cancer is the leading cancer in males. And in regards to imaging, here we have the first line of imaging for males would be normal ultrasound pelvis to assess for the prostate, and we also do scrotum scan to assess for the testicles. And if need persists for complex cases, as I mentioned, we also do CT and MRI for males.
Thank you. Yeah. So imaging quality and timing are critical. So from a radiology perspective, what are some of the most common barriers or considerations in our Fiji Pacific context that may affect how effective these cancer-related scans are?
I think the lack of awareness among people would definitely be a concern, because even though sometimes when we have our Pinktober and Movember specials, usually we would expect that there would be a larger number of patients, but however, I think there is not enough awareness spread that how important imaging could be, especially to the people who have passed the recommended age for screening. And secondly, I think the cultural and privacy concerns. So how when we're talking about breast, prostate, and testicular imaging, there's some people are hesitant and embarrassed to come forward, and it's how some people, I think, still have that conventional mindset that I don't know, but yeah, they are hesitant to come forward for the screening.
Right. So once an imaging study shows an abnormality, how does the radiologist work with a wider multidisciplinary team, that is the surgeons, oncologists, and pathologists, to ensure the right next step is taken for the patient?
So for all the scans and mammograms, CT, and scans we do, the images are sent to radiologists. So we have a teleradiologist, which is Apollo, and they send back the reports to the same site. And if there's usually a mass or some lump, then we work with the pathology team. Usually a biopsy is done to check if the contents are malignant or benign, so cancerous or non-cancerous. And in cases when, in very complex cases, when it is malignant, then usually the cases are referred to our specialists to further take the next step. So yeah, it's how we all need to work together.
So for viewers who may hesitate to book a scan or are unaware of radiology's role, what message would you like to share about the importance of imaging in cancer, prevention and monitoring, and when a person should speak up or speak to their doctor when getting an imaging referral?
I'd say don't wait for the symptoms, as early detection really saves lives. And whether you feel the slightest things, if it's changes to your breast, pain while passing urine, or if you feel like you have reached the age where mammogram is recommended, for example, then please go consult a doctor, as they will refer for the imaging services, as imaging can see what the body won't be able to tell us. And often an early knowledge is the difference between a simple treatment and a late stage diagnosis.
Thank you. So that wraps up another episode of our Cancer Awareness series. Thank you again to Ms. Nilasha for her time and her valuable insights today, helping us understand cancer screening and the diagnostic tests available here at Oceania Hospitals. So if you found this episode informative, please don't forget to hit that like, share, subscribe, and follow button on our social media pages. And once again, help us spread the awareness on cancer screening and diagnostic tests available here at Oceania Hospitals. Until next time, take care and stay safe.